73-year-old woman with severe skin problems is now cared for by Tzu Chi volunteers. Tzu Chi and Red Cross joined hands in Singapore to recruit more blood donors as supply decreases. I'm Sean Scannell. This is DAI Headlines. The 73-year-old woman with psoriasis all over her body is now being cared for by Tzu Chi volunteers. Now a neighbor is also helping her apply medicine to her skin. Covered with psoriasis all over her body, Grandma Lampong was ignored by her relatives and neighbors for decades. This day, Tzu Chi volunteers decided to take her out.
We go to have medical attention. We need to consult psychiatry, dermatology, internal medicine, and ophthalmology, a total of 4 specialties.
Volunteers kept soothing Grandma's mood along the way. The basic blood test is already a big challenge.
Her skin is very hard, and there are lots of lumps, so it is difficult to find blood vessels. The needle was inserted into her skin and pulled out many times on both of her hands. It took almost half an hour to get the blood. Finally, I felt relief.
This ointment can improve Grandma's skin. These eye drops will make her eyes more comfortable.
Volunteers' long-term care was not interrupted. After more than a month, volunteers came to visit her again and kept her company as always.
Today we see that her skin, which was cracked and bleeding on the day of medical attention, has improved. Now someone is helping her apply medicine every day, so her condition has improved so much.
The person applying medicine for Grandma is her neighbor, who was touched by volunteers' action and changed. Now Grandma no longer suffers but is filled with love. Although the peak period for pneumonia vaccines has passed, the current COVID-19 epidemic has led to internet rumors that such a vaccine can prevent COVID-19 infection. Is this true? Let's hear what the experts say.
When bacteria or virus enter the lungs and cause an inflammatory response, they are called pneumonia. The typical pneumonia of bacterial infection has many respiratory symptoms. The COVID-19 is a typical pneumonia of viral infection, which can be accompanied by systemic symptoms.
For example, it can cause systemic burnout, diarrhea, fever, tiredness, etc. It's not the same as traditional bacterial pneumonia. Bacterial pneumonia usually causes a high fever, with dense phlegm and serious cough. Respiratory symptoms are very obvious, so they are actually quite different.
Although the clinical symptoms are not exactly the same, since both of them are pneumonia, if administering with pneumonia vaccine to prevent COVID-19 infection, will it work?
The pneumonia vaccine is of no help for COVID-19 because the vaccine mainly prevents bacteria, so they are 2 different ways of infection.
Although pneumonia vaccine cannot prevent COVID-19 infection, no matter whether it is COVID-19 or influenza, critically ill patients may face multiple infections and then organ failure. Pneumonia vaccination can reduce subsequent risk.
Many viruses, after infecting our body, will cause secondary infections. Most of the pathogens of secondary infections are bacteria. So if you have a pneumonia vaccine, maybe you can be protected from secondary infections.
Administration of pneumonia vaccine or influenza vaccine can help physicians rule out the disease during COVID-19 outbreak and achieving protective effects for patients with poor immunity, like diabetic and kidney patients.
In January and February, Indonesia did not have a single case of COVID-19. In just 1 month, 1,000 cases have been identified, with many hospitals having insufficient epidemic prevention supplies. Tzu Chi Indonesia chapter began to supply such goods to battle the epidemic.
For the past 2 weeks, the warehouse of the Tzu Chi Indonesia chapter has been busy as volunteers want to donate epidemic prevention goods and quick screening tools to the government. Staff from the health department eagerly come to pick them up.
Untuk ketersediaan masih kurang karena memang
The condition in Indonesia is worsening, but the hospitals don't have enough supplies when the confirmed cases keep rising. These hospital resources are needed by every hospital.
khususnya di daerah yang kasusnya sudah meningkat.
When COVID-19 started spreading, Indonesia did not have a single case, but after the first case was found in early March, it started spreading rapidly. In just 1 month, there are confirmed cases in every Indonesian province. Tzu Chi volunteers in Kota Bantul began donating goods to hospitals.
During this critical time, we must extend a helping hand to reduce the burden for hospitals, which can focus on saving people's lives instead of worrying about trivial matters like finding these disease prevention goods.
We really need these epidemic prevention goods, and I hope that the epidemic will be over soon. We also hope that all the medical staff can pay attention to their conditions.
Menjaga kesehatannya juga.
Medan, the third largest city of Indonesia, also has confirmed cases, so local Tzu Chi volunteers donate protective gowns and masks to the hospitals.
Memang rumah sakit sampai saat ini sangat membutuhkan masker.
Our hospital needs a lot of masks, especially the medical staff on the front line. The companies that make them don't have them. It's not just the hospitals, the general public also need the masks. We must thank Tzu Chi for sending these masks to us to relieve the shortage problem.
Sangat mengucapkan terima kasih kepada Tzu Chi sudah membantu memberikan masker kepada kami.
Except for delivering goods, Tzu Chi volunteers have stopped all their events and will stay home. The Indonesian government asks people to stay home, maintain a good social distance, and wear masks to prevent the disease from spreading.
In Malaysia, the government has implemented movement control orders, though medical professionals on the front lines desperately need face shields and daily supplies. Tzu Chi volunteers obtain permission and are doing their best to fulfill the needs of the medical staff.
Wearing masks and caps, Tzu Chi volunteers are making protective face shields in the Tzu Chi office.
I know that hospitals lack face shield and masks. I also worry about my daughter, so I have come to the office to make a face shield.
Pan Siu Ling's daughter, who used to work as a nurse in Johor Bahru, has been transferred to Klang to care for COVID-19 patients. Therefore, Pan is making the face shields with her mother's love.
I hope my daughter and other medical personnel can have protective gear as they care for the patients. I hope all patients recover soon and the epidemic ends in the near future.
Meanwhile, Tzu Chi volunteers at Malacca chapter are also busy making face shields, which are placed on several big tables. Having put on protective gear, everyone is busy with the task.
Besides giving them to hospitals, we might also need to provide them to soldiers and policemen. Since Tzu Chi is a humanitarian organization, I think it is our responsibility.
Due to the government's movement control order, only 15 volunteers are allowed to go out every day. Despite that, everyone works efficiently that a college professor has come to learn from them.
Our university is also making face shields, but we are doing it slowly. How is Tzu Chi able to make thousands of them? I've come to learn from them.
Meanwhile, more Tzu Chi volunteers are busy collecting daily supplies for the medical professionals.
Toothpaste, toothbrushes, towels, shampoo, and shower gel. During this time, they need these daily supplies. The supply provider proceeds the order and asks his employees to bring these here. Today we will deliver daily supply packages first, which are needed by the Sanitation Bureau. It's about 200 sets of daily supplies. For the hospitals, we will prepare some protective clothing and masks.
City volunteers are doing their best to support the medical professionals so they can safeguard the health of the patients.
Malaysia extended movement control order to mid-April, with many shops suspending business and daily activities. Tzu Chi Malaysia chapter is concerned about the health of kidney dialysis patients, prepares 2 meals a day to reduce the risk of infection.
After the enforcement of the movement control order, supermarkets and stores throughout Malaysia have adjusted their operating hours, and many shops selling cooked food have also suspended their services. Nearly lunchtime, buses of lunch boxes are being delivered to Penang Tzu Chi Dialysis Center. The staffs are busy sorting them. About 300 lunch boxes have been prepared by Tzu Chi Malaysia chapter for kidney patients and their family members.
Now, because the government is enforcing this movement control order, buying cooked food to eat is not easy. For the sake of kidney patients and their family members' health, the most importantly for them to reduce the chance of going out and contacting others. These meal boxes for both lunch and dinner are not only for kidney patients, but also for their families.
To prevent kidney patients from clustering, they are divided into 2 groups to collect meal boxes at different entrances.
We have divided the patient into 2 groups so that they will not have any connection and contact with each other.
For current epidemic, Tzu Chi has done very well to prevent us from going out. Actually, vegetarian food does not have many toxins, so it poses fewer burdens to our body.
I'll be there in around 5 minutes. Do you have any fever? No? That's good. How about your husband? Is he fine?
Tzu Chi volunteers delivered meals to those staff who have returned from abroad and were being quarantined, and kidney patients who could not go out.
The most important thing is that when we send meals, we have worn masks and kept social distance in caring for them. When you don't go dialysis, we will send you meals. You need to take care of yourself and wash hands before having meals. It is our responsibility to do well in protecting ourselves. This is actually helping the government to control the epidemic.
Tzu Chi volunteers in Hambantota, Sri Lanka made cloth masks for care recipients and volunteers. They also pasted a mark on the ground indicating 1 meter for safe distribution. Each care recipient listened to an epidemic prevention talk before collecting their supplies.
The streets on Hambantota are empty after the government started the movement restriction on March 21st. However, the city office there is busy with the sound of sewing machines. Some volunteers sew clothes masks at home, so the mask can be given out at the distribution day. To stop COVID-19 from spreading, residents are asked to spray alcohol on their hands, wash hands with soap, and wear masks. They must keep 1 meter away from each other and listen to the talk on epidemic prevention before receiving their supplies.
Because of the current epidemic, we were told to come 2 days later to pick up our monthly distribution. Without the epidemic prevention talk, it is hard for us to know how to keep ourselves clean. So I must thank Tzu Chi for still carrying out the distribution as usual.
Tzu Chi volunteers follow the guidelines from the Ministry of Health on personal hygiene education and also complete the distribution.
In Singapore, people are going out less and the blood bank is running low on blood. Tzu Chi Singapore chapter and the Red Cross held a blood drive event.
City volunteers take to the streets to encourage people to donate blood.
Some people ask us, why do we still hold blood drives during the academic time? We will simply tell them that the blood bank is running low. We hope that everyone can do their part to help with the blood drive.
During the epidemic time, Singapore Blood Bank is running low. Health Science Authority and Red Cross are asking people to donate blood. To calm people's minds, the volunteers implement virus prevention measures. They wash people's hands and measure temperatures and ask them about their travel and contact history.
After the Red Cross staff came, they adjust the workflow. The chairs must be apart from each other. They cannot be too close.
In 2003, when SARS broke out, Singapore Blood Bank was also low. Back then, city volunteers and Red Cross held blood drives. This love is extended to 17 years later.
I've been in Singapore for many years. It is the 10th year. I came out on my annual holiday. I've donated blood in my own country, doing my best to help out. Love transcends boundaries.
At this period, I think we should do our part on our side to help as much as we can, because I believe at this period there are still people who need blood, right? We have to be brave enough to help. As long as we are healthy, then we should help. Yeah.
172 bags of blood were collected in 2 blood drive events. Despite the epidemic, people have shown their love and care for people in need.
Fujian Tzu Chi volunteers host 2 blood donation activities a year. However, the first one was delayed due to the epidemic. These volunteers now invite the public to join this activity to ensure significant blood supply.
Due to the epidemic, the blood donation event hosted by Tzu Chi in Jiangzhou City was stopped for 2 months. Recently, it was launched again, and volunteers started the preparation in advance.
It was stopped for 2 months, and now we need to wipe everything clean, so tomorrow when everyone comes, will be sanitized.
Volunteers did all precautionary measures to welcome the public. However, this donation event requires everyone to fill in a health condition document on top of the basic information.
In order to ensure that the blood is safe to use, we will ask people who have certain symptoms to not donate blood. If not, the key is to make sure the blood is 100% safe. During this tense period when the whole city is fighting the virus, Tzu Chi is able to organize a huge crowd of suitable individuals to donate blood. It will certainly be very helpful to our blood supplies.
On top of the kind-hearted people who came to donate blood, there were also volunteers at the venue to show care, hoping to make blood donations feel at home.
The multi-grain congee can give the nutrition after donating blood. This is safe and eco-friendly as they bring this cup home as a memory and can decrease the use of one-time utensils.
After I donated blood, my sleeve was still up. The sister came to warm up my hand immediately, and I felt quite sweet.
The epidemic has gradually eased down in Jiangzhou, and the hospital has resumed to normal function. Volunteers hope that the warmth could continue to pass around in society.
Japanese chef Hu Taibing has 26 years of experience. As the epidemic worsens in many parts of the world, he decided to switch to selling vegetarian food. He hopes to encourage more meat eaters to try vegetarian food and show their love for animals.
This Japanese restaurant hands the banner, saying that it is now switching to vegetarian food.
If we are able to cook with skill, plant-based food will appeal to meat eaters. And maybe we can relieve the pressure on animals.
Hu Taibing, who has been a Japanese chef for 26 years and has operated a restaurant for 15 years. Not wanting to sacrifice the lives of animals, he's switching to selling vegetarian food.
Indeed, he is crazy. How is this possible? He's running a restaurant with 10 seats. How do you operate this restaurant?
I start from scratch. Through our professionalism, we can help meat eaters to start eating vegetarian food. If I can do this, this would be my achievement as a chef.
Dharma Master has told us to eat vegetarian food to help us pass this epidemic.
After 2 years of experimenting and development, Hu has switched to selling vegetarian food during the current epidemic. As more people eat vegetarian food, they can also show their love for animals.
An F-16 jet fighter has 200,000 parts. Its wiring harness can stretch for tens of kilometers. Maintenance can be quite difficult. But in Taiwan, there's a woman who repairs such jets. Follow our report as we learn more about this very special technician, Tzu Chi. In the early morning around dawn, 100 people are working in this maintenance hangar. One of them is a petite female engineer, Tzu Chi. Tzu Chi is 30 years old and is a graduate from the Department of Foreign Languages of Asian University. She has participated in IDF and Boeing 747 projects as a technician and is now a member of the F-16 Performance Improvement Team. After discussing with the technician, they carefully position the part.
Now there is a groove in 325 and there is a space there. Everywhere else we have to open it up. I also like to be one of the first. This is an unknown field, so I had few expectations and did not know what to expect.
A woman who studied liberal arts is highly unlikely to be engaged in aircraft maintenance, especially fighter jets. Though she is not as strong as men, her delicate attitude and petite figure is a bonus for the team.
The fighter has a main bulkhead, and its fasteners are relatively large. When it is locked, the bulkhead fastener screw may reach thousands of pounds, so strength is tightened, it can take a lot of strength. There are some places where the ship's bow is relatively small. When it comes to girls, sometimes the scope of thinking is wider. We will think about it more thoughtfully.
The fair skin is particularly noticeable amongst this group of men. Everyone thinks the work is difficult, and she wouldn't last. 9 years later, she has broken through everyone's expectations.
There is a lot of oil and the paint is very smelly, and most of the girls can't stand it. Many thought she would be clamoring for a different job change within a few days.
Hey, I think the access here is not enough. Can we change the solid rivets into pull fasteners?
She can also talk in English and have first-hand professional communication with foreign engineers, allowing her to progress faster in this field.
In a new field, you have to be determined. After learning it well, you want to see how it will develop in the future.
Like other girls, I used to dream of being an airline stewardess. For the interview on camera, she asked about her appearances.
It's okay, I'm just a staff, and though I still have ink, I can still come here for the interview, right?
Her informal personality makes her more willing to follow the rules. Although she's not a stewardess, she does important works to keep many planes flying in the sky. To promote vegetarianism, Tzu Chi volunteers in Taipei recently prepared 150 lunch boxes and sent them to the CDC so workers at the front lines of the epidemic can feel appreciated and promote a meat-free diet. We'll leave you with this. Goodbye.